Hi, I'm Dr. Jared Gardner, and I'm a pathologist. And for those of you who know me, you know I'm also pretty involved in using social media for medical education and a lot of other things. So this video is I'm making this video as part of the COVID-19 coronavirus pandemic module for my medical students, but I'm also going to probably allow this content to be repurposed for other modules and maybe even released publicly on YouTube in the future. So if you're watching this and you're not one of my med students, I just wanted you to understand why I'm referring to my students repeatedly. So what we're going to talk about here is social media and the role that it plays, both good and bad, in communication about medical topics, particularly things like COVID-19. And I think that I've got a little paper here to make sure that I don't forget anything important to say. But I think that the really important thing that we have to recognize is that as doctors, as medical students, as other medical professionals, we have an important job to play in the public's eyes of making sure that the information that we provide online, what we say and do, is helpful and helps educate the public, and that we're careful to make sure that what we share is useful and legitimate information, so that we don't cause confusion in the public, because the public respects and trusts overall. Not everybody obviously respects and trusts doctors or other medical professionals, but I think that in general a lot of people do. And for you guys as medical students, your generation doesn't really need help learning how to use social media. When I give lectures to people from my generation or maybe older generations, sometimes I have to teach them, well, here's what Facebook is and here's what Twitter is. You guys understand all of that stuff, but I think the really important thing is not the technical detail, but understanding like what role should medical students and physicians and other professionals play in sharing information. What can we do? What should we do? What should we avoid? So I'm going to talk about a few of those things today. I have a guide on how to make how to do social media professionally. It's aimed at pathologists, but I think the topics there apply really to any medical professionals, and it's about stuff like how to stay out of trouble with HIPAA, how to separate your personal and your private life on social media, things like that. This is basically a web page that I've built over time with frequently asked questions that I get when I give lectures about social media. So I think that you guys, no one needs to tell you that social media is a powerful tool. It's incredibly powerful. It's a way to share information very quickly, but also it can be used to share misinformation. And just like any tool, it's all about how you use it, who is using it, and how they're using it. And the wonderful things about social media, the way that we can share medical education and medical knowledge around the world for free in a fraction of a second, that also can be used for evil and can be allowed to share misinformation and sources that are not legitimate. So I think that that's really important that we recognize those things. And fake news is a thing we hear a lot nowadays, and I think it's actually important to think about that. Because even though people sling that around as an insult, I think that this is not a new phenomenon. Fake news has been around for a long time. I was listening to a podcast, and it was talking about during the 1800s political campaigns, and how newspapers were very, very partisan in the 1800s, and they would strongly support one candidate or the other, and people would basically say, oh, well, those reports are not legitimate, they're fake. And so even it was really striking to me that even back then, 150 years ago or more, the idea of fake news was around. But now I think it's become, it's morphed and changed, because now we have this abundance of information. Yes, you can go fact check anything. The question is when you go Google something, what facts will you find? And social media, again, has amplified that all these things get shared, and sometimes the things say totally opposing viewpoints, but it's too late because the person's already seen it, scrolled past it, clicked like, click share, click retweet, and then it's out there and someone else has already viewed it, and the misinformation may have already been passed on to another person. And I think that we now recognize that fake news is a thing, that there's so much information out there, some of which is legit and some of which isn't, that people have a tendency to just say, well, I don't trust anything I read online. Or let me rephrase that. They say, I don't trust anything if it doesn't agree with what I already think or believe to be true. And I think that's a danger, not just for the general public, but it's a danger for us in medicine or in science, any of us, that we can have this tendency to believe the things that we see and we can disregard everything else as probably being fake. So I think it's important for us to recognize that we're not above or immune to that kind of bias. And the other thing I think is that really it's important for physicians and even for you as medical students to have a public voice. And now in this pandemic, is a perfect example of why it's important that when we all have a public voice, it gives us a chance to speak up and provide legitimate source of information for members of the public who are hungry and desperate for that information. And I made a couple of videos about COVID-19, and they ended up becoming, within like a week or two, the most viewed videos on my YouTube channel, which I guess isn't surprising because normally I post about skin pathology and very esoteric stuff, and here's something that's relevant to basically everyone in the world. But I was totally, I guess I shouldn't have been surprised, but I was surprised by not only the number of people that said this is great and helpful, but the significant and very vocal minority of people that said you're paid off by the government to lie about this is a conspiracy theory, all sorts of, really, nasty things and crazy things that people said. And I guess like I said, that shouldn't have surprised me. But the point is that there are people out there that don't agree with what we'll say, and they are not going to support it. But that's why it's important for more and more of us in medicine to have a voice where we can share legitimate information, so that those members of the public that actually want to get this information, they know where they can go. And a lot of the things though that I heard people say, negative things, was, well, this is just done by this political party or that political party. People get really caught up in politics and other divisive things, and it's real easy for them to not believe a certain news source because this channel supports that party and this channel supports that party. So for me as a physician, I've worked really hard for the past, several years that I've been doing social media online to stay away from politics and other divisive topics. I try to just stick to medicine and science and things that are legit and that are very neutral and hopefully helpful to others. And what's great is that gives me a place now to say, look, I have nothing in this. I'm not being paid to say anything. I'm not supporting this or that party. I'm not owned by anyone. I'm just a guy who's trying to take care of sick people and educate others. And so actually by being kind of neutral and staying away from those divisive topics, it allows us to be a more believable voice, because sometimes people are going to disregard anybody that works for this administration or that administration. Anything that comes from this news station or that news station, they won't believe it because they believe that it's partisan, or that there's something that's swaying them to say it in a way that's not true. And so there's this great distrust among some people, at least, of the media and of politicians, and it's not totally surprising to see why people feel that way. But I think that's why we can be a voice, a neutral, positive, and honest voice, and we can be there to provide info to the public when they won't trust other sources that would normally have given that kind of information in the past. And so I think that we have kind of a social contract as physicians, right? The Hippocratic Oath is a promise that we will take good care of our patients and we will do the right thing as physicians. And the public for thousands of years has trusted doctors, even back before medicine was really very scientific at all. But the idea was there that the patient entrusted themselves into the healer's hands and that the healer would do right by them. And I think it goes beyond just our duty to our own patients. There's that same kind of feeling that the public has towards doctors in general. And maybe that feeling has eroded some in recent years. But I think there's still a lot of people that respect and trust doctors and expect us to do what's in the best interest and in the good of the public. And I think we have to really take that respect as a very serious thing and work really hard to always make sure that the way we behave ourselves in real life and online is with ethical integrity, and is professional and upright in every way that we can be, because people will hold us to a higher standard. And if we abuse or if we treat that lightly, I guess, the higher standard people hold us to, then we may miss that opportunity to have people listen to us in the future. And one thing that I have learned over time doing social media is people do listen. They read what I post, even if they're not commenting or clicking like. People see the things I'm posting about. Let me give you an example. Some years ago, I've shared some posts about vaccines and why it's important to vaccinate our kids and to not to not believe the conspiracy theories about all of the terrible harms of vaccines. All that stuff, is out there that's there to confuse people and lead people astray, and that vaccines are safe and helpful and good. And so I've posted that before, and of course, there's always some people that are there to give me flack about that. But what I found out was one of my friends from way back when I was a kid, who's been friends with me on Facebook, and we hadn't really talked much for years. He was having a baby, and he sent me a private message and said, "Hey, I've seen you post about vaccines before. Some of our family and friends say we shouldn't vaccinate our baby, but I know you're a doctor and that you've posted about it. So, what are your thoughts?" So the point is that he remembered that I had said something, and he thought, I'll ask Jared. He seems like a legitimate and unbiased source of information, and maybe he'll tell me what he thinks. So of course I said, yeah, I vaccinate my kids. I vaccinate myself. Of course it's something that I would recommend for everybody who can, unless they have a medical reason not to. And I thought that how many other people out there are listening and paying attention, even if they're not responding. And by the way I make sure that every day I try to post in a way that's upright and that shows integrity, I think that over time that builds trust from other people. And then when they have a question like that, or when I post about a topic like the pandemic, or hey, you got to take this seriously, this is really a real situation and we need to pay attention to, then hopefully people will listen because of the way they've seen me act every day on social media. I think that that's the goal that we all should strive towards in our social media behavior. And I think that that's a great way that we can add value. And it may be only for occasional people here and there where it might make all the difference in the world for them making the right choice medically by getting legitimate information from us. So let's talk about that. So you all have social media channels, so do I. And I think that the question for doctors, especially for those of you who have had social media since you were in high school or middle school, maybe even, and didn't really even know you were going to be a doctor, and now you're almost ready to graduate med school and you're going to be a physician, and you may wonder, well, where's the line between personal and professional? And that's actually, I think, a unique thing for your generation and the coming generations who you are digital natives. You have grown up in the digital world and the social media world and don't really remember much of a time where there wasn't social media and digital information constantly around you at all times. I didn't get my first cell phone until I was 19. I met my wife at a punk rock concert, and she was living in a different town, and it's a true story. And I wanted to keep in touch with her, so I went and bought one of these little Nokia brick phones so that I could call her. And we've been married almost 17 years, so that was a good investment that panned out pretty well for me. But the point is that maybe I was a very young adult when I learned how to use computers and how to use smartphones and social media, but I still had to learn it as an adult. But for people that have grown up around this, I think it's a very different sort of challenge. You have to learn how to separate out your past on social media and the way you behave now on social media, and to draw lines between what's private for you and what's your public image. I think having a public presence, whether it's a public Twitter account, a public Facebook page, which can be run from your normal personal Facebook account. You just go on there and say, I want to set up a page as a public figure. You can say that you're a medical student or you're an MD 2B, that you're going to graduate with an MD in a couple of years. And then you can post publicly about medical things, and you can make your own personal accounts private where you keep stuff there for friends and family. I would encourage you, and this is just general advice I give to everyone, don't post anything truly terrible on your social media. I hope none of you would do that anyway, and I hope none of you would say or do terrible things. But if it's something that you think, gosh, if this ever got out, I would get in huge trouble, do not post it. I mean, that's just common sense, but I think that sometimes we have to be reminded of that. And until you see how badly things can happen when people do make really inappropriate posts and then they do go public, because anything and it's not just for social media, the same is true of email, right? If you email it just to one person, they can take a screenshot and share it online, or they can forward that email to everyone in the company, and that can be a real disaster. So the general rule is, if you're going to say or post something terrible or awful, just don't put that anywhere on any computer, because nothing is truly totally safe. No matter how careful you are with your privacy settings, there's always a chance that stuff could get shared and could cause a problem. And that's it's partly about just like, don't be a jerk, don't say and do bad things, right? But also there's a real potential to cause harm to yourself publicly, to your public image, even to your employment. So it's something you really do have to take seriously. And I don't say that to make you fear social media. Again, I use it extensively, and I think it's a really powerful tool. It has really helped me in building my career. It's helped me educate other people. It's helped me learn. There's so many benefits if you do it the right way. But I do think you have to approach it thoughtfully. And it's not a bad idea to have your personal accounts separate from your public accounts. Also, like in my case, I post pictures of tumors and, worms and weird things that not all of my friends and family are going to want to see. So I post that stuff on my Twitter, my Instagram, which is also totally medical, and my public Facebook page. And then I leave my personal Facebook account for pictures of my kids and, what I cooked for dinner the other night and stuff that some of my friends and family are more interested in. Now, I have friends and family who really like the medical stuff, and they subscribe to my public page and my other accounts, and they love seeing the pictures and the information I post there. They think it's fascinating. But this allows me to protect those of my friends and family that don't want to see that. So I post the medical stuff on the medical page. If it's something medical that I think might be relevant to friends and family, like for example, when I made the COVID-19 videos a couple weeks ago, I shared those publicly, but I also shared them with my friends and family, because that was kind of one of the reasons to make it in the first place, is because I knew friends and family had questions that they kept asking me. And I thought, I'll make a video and put all of the answers in one place to make it easy. So once you have a professional social media presence, a lot of times things will go well. But there are times where you'll do all the right things and you'll post stuff, and there will be a vocal minority that says, this virus is a conspiracy, I don't believe in it. Or it's crazy, it's just like influenza, why are we shutting down the whole world because of something that's not worse than flu? Or they'll post links to some, conspiracy theory video or website, or they'll actually say nasty, attacks against you as a person. Those things are thankfully infrequent, but they do happen, and I feel like the closer you get to issues that are kind of hot topics, the more you run the risk of having this kind of backlash. When I post about random pathology topics, I don't get a lot of backlash. There's not that many people that have a vested interest in disagreeing with the way I diagnose skin cancer or something like that, for example. But here, where there are more public health issues at stake, or issues that maybe touch on politics, obviously there are people that are going to have a vocal opinion about that, and that opinion will not always be friendly or kind. So how do you handle those scenarios? I think the ways that some of the general rules that I use, like I said, I try to avoid talking about politics. I do know some physicians who feel strongly about political issues that are related to medicine and patient care, and they want to have a public voice and be a political advocate. That's okay if that's the direction and the path that you choose for yourself, but your social media experience will be a lot more tumultuous, and you will have negative things to deal with on a more regular basis if you want to be involved in public health debates that center on legal issues and on political issues. But you can decide that for yourself, but I would in general recommend that you be very hesitant to get involved in that sort of thing while you're a medical student or even a resident. Once you're in practice and have an established career, then you can decide, this is my brand and I'm willing to stand on this and stand for this cause, even if I get flack for it. And I know some really great physicians who do that, but I definitely have seen how they've had to argue with people along the way, and they've had trouble. And I've definitely seen times where it can potentially negatively impact trainees who have strong vocal opinions about divisive issues. I'm not telling you not to stand up for what you believe in. I'm just saying to think very carefully about it and about how you go about it. And of course, if any of you have questions about this or any specific issue, I'm happy to talk to you directly about it and give you my advice anytime, because I've spent a lot of time thinking about social media and advising other people in how to best craft their social media presence in a way that works for them. So I'm always happy to help you. I've had students before ask me about, I posted this really stupid thing, 10 years ago, and now I'm worried someone's going to find it online and I'm going to get in trouble. And I'm happy to talk with you guys about that kind of stuff anytime you want. So, but I do think that to be really careful about getting involved in divisive topics, unless you're sure that that's the path you want to take publicly and a stance you want to have publicly. I think that anything I post online, I try to post it under my own name so that I'm sure that, if I'm saying this, I'm staking my reputation and my name on what I'm saying here. And I try to think of that I think it holds me to a different level of accountability to know people can see this is what Jared Gardner said, and they can say, oh, look, you were wrong, or you were a fool, or whatever. So I feel like I want to be comfortable enough with what I'm posting that I'm happy and willing to have my own name and my reputation attached to what I say and what I post online. And I think that helps keep me out of trouble, to think about it that way every day before everything I post. How is this gonna look to someone else reading it? That's actually not a bad idea too, is that before you post something, always read it over and make sure there's not typos, things like that. But also think, how is the tone of this? Will this come across the way that I intended? Tone and nuance is really hard to get across in written communication, right? That's why I tend to use emojis a fair bit, because I think it helps get across the idea I'm saying this in a lighthearted way. But I think if in doubt, don't phrase it that way. If it's a joke that you think would be really funny in person with your friends, it may not go across that way to everyone reading it online. Especially maybe that there are people that are not in the medical world, or there are people that English is not the first language, or things like that. Sometimes jokes that might seem appropriate in a setting with your friends, even if it's not in any way an inappropriate joke, but a joke that might have some sarcasm or something like that, those things can get read the wrong way. And I've definitely had times here and there where I've posted something and someone took it the wrong way, and I was in no way intending it to come across that way. So it's made me think a lot more when I post something. How can I post in a way that is honest, humble, kind, genuine? I feel like the more we aim towards those kind of ideals, the more likely we are to be well received by other people and to have our message get across. And that's the reason. It's not just for people to like us or follow or subscribe to our channels or our accounts. It's so that I would hate for a bit of humor or something else to make someone be turned off from what I'm saying and miss out on the information that might actually be helpful to them. So that's why I work really hard to try to strip away anything that I think might detract or frustrate someone else or make them turn away from the useful information that I'm trying to share. The other thing is, try to avoid drama and arguing. You will sometimes have people that will want to disagree with you, and not all disagreements are bad. It's good to have healthy debate and discussion, but you will definitely have times where there are people that are what we would call trolls. I know you all know this term, and I think it's a term that can be used as a pejorative and as a to throw at anyone who disagrees with us. But there certainly are people who love to just post negative things for the sake of riling other people up and getting a rise out of them. Do not respond to those people. Do not feed the trolls. That's the general analogy that people say, and I think it's such good advice, and it's so very, very hard to do. When someone is slinging mud at you and saying terrible things about you and accusing you of being paid off by the government or by big pharma or whatever crazy thing it is, of course you're going to want to go and defend yourself, because you're like, I've done nothing wrong and I'm trying to help. Don't. Just leave it alone and don't respond. If people are being really nasty, you can block them. You can unfollow and mute them on Twitter. If you don't want to fully block them, sometimes I will not block people because I know that I post educational stuff, and I don't want to punish people and prevent them from seeing educational content, because it might actually help them. But I definitely don't want them making comments just because I don't want to have to deal with it. There's nothing wrong with that. I mean, sometimes there are certain people online, and it's not very often, but I've had people that were so taxing mentally because they were so negative and so argumentative that I just unfollowed and muted them, because I didn't want to end up having to see their posts and get frustrated by it. And these are my channels. I can handle them the way that I want. It's a democracy, right? There's free speech, but not on my channel. My channels are mine, and I get to speak there the way that I choose to. And if you want to say something different, that's fine. Just go and start your own channel or your own account and say those things. I'm not meaning that to sound harsh, but I mean, it was my wife was the one who actually had to give me permission to say, that person is being really difficult. Why don't you just disconnect from them online so you don't have to deal with the antagonizing, responses that they're always posting. And it was very freeing actually to realize that, yeah, it's okay to do that. If you need to, you can block people. That's why those tools are built into social media. And it's not that you necessarily want to delete every comment or block every post that's negative or where someone disagrees with what you're saying factually, but when people are making ad hominem attacks about you as a person, or negative comments about your physical appearance, or things that are just inappropriate or gross, it's okay to block them. Feel that know that that's okay, and feel free to do that as needed. The other time that a great example, if you want to see some ideas, under my COVID-19 YouTube videos, you'll see that there's a fair number of negative and disagreeing posts and comments that people have made, and I've left some of those there. If they think, well, I disagree with you, that's that's fine. But what you won't see is there are quite a few posts that I've actually hidden. It's on YouTube, you can't fully block people, but you can hide their posts so that any comment that they make will not show up to any other user. It'll only show up to themselves. And the times that I really want to do that is if they're posting a comment with a link to a source that's going to mislead people. I don't want them to piggyback on one of my videos that's become popular and then post content there and links to draw people away, people who might be reading the comments, and then go to some other site and that's filled with medical misinformation. So I want to make sure to avoid that. So anything that I think is going to confuse or detract from the truth or the facts and confuse people who are watching the channel and then reading the comments, I'll hide those kinds of things, or on my Facebook page I'll delete the comment, things like that. Sometimes people will make a post and their negative comment will be something that I hear very frequently, but that I have actually a good response to, and then I'll come back and I'll reply and say, well, no, that's actually not true, and here's why, and here's a link to some legitimate sources. That can be another way to deal with it. Because it allows you to address a common misconception in a way that's factual and that's scientific. And the really important thing here is sometimes people will pair that with a nasty personal attack. And it's really important to step back and calm yourself down before you reply. And it's, again, I'm saying this from personal experience, it's so hard to do this. But the more you practice it, the easier it gets. And try not to come back at them and attack them about how stupid they are, how they don't have any credentials and you have more training. That stuff, the reason that you don't want to do that is because people will read that and they'll think, this guy's just an arrogant jerk. And they won't listen to what you're saying afterwards when you're trying to share information that's helpful. So I think that you got to be careful, even if someone makes an ad hominem personal attack against you. If you're trying to respond, do your best to avoid responding. Just ignore that part of it and respond back with the factual information. And again, you can scroll down and see some of the comments that I've responded to where people have said things and I've just come back with, well, actually, no, here's what the data says about this, or here's a link to a site that has more legitimate information for you. So there's different ways to handle that, but I would advise you that arguing and drama, people say they don't like drama in their lives. But that's a lie. People don't like drama in their own personal lives, but they love to watch drama in other people's lives. I mean, that's evidenced by, Tiger King and shows on TV where we love watching other people's drama, but we don't want drama to impact us. And it's true, on social media, someone might make a negative tweet or a negative comment to you, and if you don't even respond to it, a lot of times it'll just get buried under all of the other comments and posts, and no one will even end up seeing it. But once you argue and go back and forth with another person, then that will draw it up to the top of the feed, particularly on Twitter, and then people will see it and they'll start watching, the popcorn gif that, people are there to watch and see what happens. Try to avoid that, because that's just bringing attention to the people that are making the negative comments. Again, I know it's really hard, but that would be what I would advise you, is that you try to avoid getting into big fights. Sometimes I'll respond back one time, and if the person wants to keep going, I just leave it alone and walk away from it. You're not required to respond to every comment or every time someone tags you on social media, okay? The other thing is, when you're angry or when your inhibitions are low, whether it's because you're really tired, you've had a really rough day, you had a couple drinks, whatever it may be, don't post on social media at those times. And I think that just put the phone down. If you're, I guess I would normally say when you're at a party, but nowadays we're not at parties, or we shouldn't be because of coronavirus. But that's what I've usually told people in the past. You're at a party, take a picture with your friends. Don't tweet it now. Wait till tomorrow, and then you can decide if you think it's still appropriate to tweet. It may be totally fine. Or by the light of day, you may say, ooh, maybe that one's just to keep for my own personal memories, and maybe that's not the look that I want to portray on my professional public channels. So I think that that's an important thing when you're in a lower state of inhibition, and that includes when your temper is high. So you maybe want to respond to someone right away because they said something nasty and mean to you online. But try your very best not to until you've calmed down. Wait a day. There's nothing that forces you to have to respond right now. Sometimes too, it's been really helpful. My wife's a psychiatrist, so it helps me a lot. But I often, if I'm responding to an email even, or a social media post, and there's some tension there, there's some controversy, I'll actually often write up a draft, like in Note on my phone, not there like where I might accidentally click tweets, and then I'll show it to my wife and say, or to other people who I trust, and say, hey, do you think this sounds legit? And oftentimes people are like, pretty good, but maybe take that word or that word out. That's a little strong. And by doing that, it's helped me over time to learn how to respond more appropriately to those things. Because there have been times before where where there was something that was new and hot that came out, there was a controversy, an argument, I had a strong opinion about it, and I made my opinion known, and I was really upset about the situation. And maybe I was a little bit more strongly worded or harsh than I should have been. And even though I stood by what I said and what I was saying was right and all the righteous indignation that I felt about it, you know what? It didn't actually help the situation. It turned out that I didn't know the whole story, and there were people actually actively trying to resolve the conflict in the scenario. And I was riling up people in the public out of my own temper, my own frustrations. And it didn't make things better, even though I thought I was trying to do the right thing. And I realized in retrospect that my temper, my frustration, my anger, rightly placed though it was, all the right intentions of the world don't matter if you make the problem worse. And I realized that I probably, if I would have thought things through and not been as angry when I posted, if I would have investigated a little more, I would have actually seen the whole story. So that's part of the lesson there, is don't post when you're angry. And the other part of the lesson there is when something controversial drops on social media, especially if it's something that you might be peripherally involved in, or that it's about people that you're peripherally involved in, just back up and don't post. Wait until you find out the whole story. Sometimes when things first come out, the first release of information is not always a complete picture of the whole story. And over the next hours or days, things will evolve more, and you'll see, oh, there's actually more complexity to this story. And if you would have posted right away after it came out, then once the complexity comes out later, you might feel a little bit like a fool. I have definitely seen that happen in my own life, and I've seen times where I held back, and a day or two later, when it became clear, oh, there's a lot more to this story, it is not at all how it looked at first, I was really glad that I didn't make public comments about it, where at the time it seemed okay, but later on, once it was more clear, I was glad that I didn't make comments. So I know I'm being kind of vague, and that's for an intentional reason. So in any case, I think that those are some take-homes that I've learned from my own mistakes, okay? The other thing is that when we're sharing information, especially now during a pandemic like COVID-19, we want to make sure always that we share legitimate information, and when we share links, that they're to a legitimate site or a legitimate resource. But it's especially true now in this time where people are hungry for information, people are quick to share information about a rapidly evolving situation where things change in a matter of hours or days. Things can be quite different from how they were before. So I think it's important whenever I post or when I make a video, I try to be clear about this is my experience or my personal opinion about something versus this is a published fact and there's a link, here's a link for that information if you need it. I try to sort out what my opinion is or my experiences versus what's published or what's verified fact from a legitimate source, okay? I also try to be honest about when I don't know. When I say, you know what, this is not my area of medicine. I actually don't know about what kind of drugs to give for this. I know about this type of diagnosis or this type of testing technique, and that area is not an area of my expertise. There's nothing wrong, even for me as someone who's an expert in my little area of medicine, to say to people, hey, I don't know the answer to your question about this or that thing that's outside of my area. It's nothing wrong with you as a student or whatever, if you're someone else watching this in the future, whatever your role may be, to just tell people, here's who I am, here's what I know, and I'm trying to help in the situation, but there's still a lot I don't know. There's nothing wrong with you saying, I'm just a medical student. And I use the word just there, not in an insulting way, but to say you can use that as an excuse to say, I'm a student still, but here's what I do know, and here's what I know is a legitimate source, and I want to share this information, but I'm not claiming to be an expert. I'm just claiming to say, with the knowledge that I have, I'm trying to do good. That's a humble approach to take, I think, and I feel like in my experience that resonates well with people. Not very often do I have people give me trouble online when I say, I'm not an expert in this area, here's what I do know. Usually people receive that well. Again, you'll get the occasional troll here and there that are trying to discredit you because they don't like what you're saying. And then the other thing is that we have to be careful that when we share, sometimes we'll retweet things because we see a headline, and it's not necessarily wrong to retweet something without reading it, but there is a risk, okay? And the risk is that unless we're really sure what the source is, and that the headline or the tweet with the link, that what the tweet says is actually representative of what the link to the resource, whether it's a medical paper, a newspaper article, whatever it may be, if we're not cautious, sometimes people don't click the link and read. Is that their responsibility to do? Yes, it is their responsibility. But nonetheless, if we share something, it turns out that there's a sensational headline on it that's really not supported by the facts, other people will do the same thing. They may just click and share it, and by then the damage is done. Whether you had all the right intents or not doesn't matter, right? The point here is trying to do the most good and minimize the potential for misinformation or harm. And I feel like during times and about topics like this, where there's a lot at stake, we got to be extra careful to make sure that what we're sharing is legit. For one thing, just because it's the right thing to do. And number two, if you share something and it ends up being totally wrong, that looks bad on you personally. So from a professional reputation perspective, obviously it's much less important, your reputation, than doing the right thing. But I think we do have to think about the consequences professionally for what we do online. So I try to make sure that I've at least looked over the article if I'm going to share, unless it's from a site where I know, it's a legit source of information, right? Then the other thing that we have to keep in mind, and this has particularly, I think, been evident in the COVID pandemic, is that there's a lot of stuff that gets mentioned or published in the literature, letters to editors, small series, things where doctors are trying to share ideas and researchers are trying to share ideas based on the limited information we know as we learn it. For example, does, hydroxychloroquine or chloroquine play a role in treating coronavirus? There have been some papers suggesting it does, but other people saying there's not good data for this. And we've seen that the public, desperate for there to be a solution, has latched onto this. It's not that it's wrong for us to talk about potential treatments, especially in the context of the medical literature. But the public and the non-scientific, non-medical media have a tendency, even in the best of times, to latch on to any article headline of, this thing showed, activity against this virus or against cancer cells in vitro in the laboratory. And we all know that just because a medicine added to a dish of cancer cells makes some of the cells die doesn't mean that that's going to be a successful drug that can be used in humans to treat cancer and not have side effects. And the same is true for antivirals, antibiotics, anything, right? This is how science progresses over time, is that we have these back and forth discussions, people test and retest, and eventually we come to a conclusion about what we can do. But early information and early data often gets latched onto, particularly by people that have an incurable disease, or by the media that's looking for a good story. And I'm not saying they're trying to intentionally deceive, they're reporting on what they find, but we know that there's a lot more nuance in the medical literature. And that just because something got published as a small series or a letter to the editor does not mean that it's ready for primetime use. And I think that we have to be particularly careful when we share stuff like that to help people understand people are talking about this, or there are trials in progress, but there's really not a clear answer yet. And to help our non-medical and non-science colleagues, friends and family, better understand that there's a lot of nuance and complexity, and it takes us some time. And I know that right now we have this urgent situation where time doesn't seem to be something we have very much of for some patients, and we want an answer now, but we know that just because one person seemed to get better because they were given a medication, or a small group of people seem to get better, that doesn't mean that it's something that's safe and effective, and that the risks and that the benefits outweigh the risks, if there are any benefits at all. So I think that we have to help non-medical and non-science people understand that there is a lot of nuance there, and that we have to be cautious, especially with early reports about things from small studies. And again, this is something that has been brought to the highlight right now in COVID-19, but it's something that happens all the time even outside of the pandemic setting. Particularly, I see it with cancer drugs a lot, right? You see people, I'm in a lot of cancer patient groups, and a lot of times the patients will read some study or some newspaper which is summarizing a study and say, this thing said that this has efficacy against this type of cancer cell. And I know it's that people are just desperate for something, for hope, right? And there's nothing wrong with that. But obviously we have to make sure that we're still supporting good science and good medicine, and that we're helping people understand that. The final thing that I'll say and leave you with, and again, if I find some other resources that I think are helpful, just check in the video description below, and I'll try to add some links over time. And the goal of this is so that you can refer back to it and get some insight and some of my thoughts and feelings about how to approach dealing with social media in these difficult times. but I'll try to put some links to some resources down in the video description. But I think that the final thing I'll leave you with is that sometimes it can be hard with social media when you have friends and family, people that you love and care about, who share information that's not true, share links to resources that you know are not legitimate, want to argue with you, or make comments that seem like conspiracy theories about medical information. And it can be very challenging to know how to best handle those things, because it's okay to have people that you love and care about that have totally different beliefs from you. It's okay to love people who are conspiracy theorists about certain things, particularly when it comes to medicine. I will tell you, it can be very challenging, though, to navigate that territory. And I think the most important thing is that you just recognize that you can separate the beliefs and the comments made by your friends and family from the fact that you care about them and you love them, even if they hold very different opinions than you. And that's happened in my own family. I know people in my family that don't believe what I do about vaccines, or they have different views about holistic therapies, and they're still people I love and care about very much. Usually I just avoid discussing those particular topics and everything has worked out fine. I know sometimes you don't always have that option, and I do recognize that there's not a one easy answer for this, but I think the most important answer is try to love people through that. And particularly now, to understand that, people are scared, and when people are scared, particularly about medical things, they're going to react in different ways maybe than they would normally. They're going to be a little bit more sensitive about certain things. They're going to respond in ways that might seem like they're angry with you. Try not to take it personally. Try to understand that this is a reaction based on the difficult emotional environment that we're in. And here, this is my psychiatrist wife coming out now, but it's totally true. If you just try to be as respectful and empathetic and kind towards those people as you can, even when what they're saying is difficult to hear, I think that goes a long way in smoothing things over and hopefully eventually making you a resource that they can actually believe in. If they see that you treat them with respect, even when you have disagreement with them, over time, they may actually trust you. And I have seen that actually happen in my own life with my own loved ones who have at certain points in time come to me and actually listen to what I said when it was something really serious. And I was so thankful for that, and so thankful that I had not burned that bridge down in my righteous indignation about being right and proving them wrong, that I had recognized that there are certain things, certain battles that are just not worth fighting, and certainly not worth losing friends and family and loved ones over. So I hope that gives you a little bit of an insight into the pros and cons of social media, particularly in dicey situations. And I hope that you all stay safe and that everything goes well for you throughout your careers. I'm really proud of you guys, and I'm really sorry that I'm not there for you at match day and at graduation. And I know it's been a really rough time to be finishing med school in the spring of 2020. But I'm looking forward to really wonderful, great things from all of you in the future. And if you ever need anything, you know where to find me.